Welcome back to Think and Act Locally.
It's great to be back.
We're all about empowering folks right here in Deer Park, LaPorte, and Pasadena, Texas,
Absolutely.
to make our corner of the world a little bit better. And sometimes that means getting inspired by what's happening elsewhere.
For sure.
You sent in a fascinating interview with Dr. Patrick Soon-Shiong on the Dr. Drew podcast.
Yes.
And it got me thinking, can one person really make a difference in such huge, complex systems
Right.
like healthcare and journalism?
It's an intriguing question.
Yeah.
Especially considering this isn't just any doctor.
Right?
Dr. Soon-Shiong's background is incredible.
Okay, lay it on us.
A transplant surgeon,
Oh, wow.
biotech entrepreneur,
Okay.
inventor with over 675 patents,
Whoa, hold on.
and since 2018, the owner of the LA Times.
Okay, 675 patents. What in the world has he invented? Is this guy like a real-life Tony Stark?
Well, he's certainly innovating in multiple fields.
Right.
He developed Erbitech's major cancer medication,
Wow.
and pioneered whole organ pancreas transplants.
Goodness gracious.
But what's interesting is how he sees connections between these different areas.
Okay.
Like when he talks about his experience with transplants leading him to cancer research, he's constantly looking for the bigger picture.
So it's not just about the individual accomplishments, it's about his way of thinking.
Exactly.
Yeah.
He seems to be applying that same holistic approach to tackling problems in LA, publicly criticizing the city's leadership for what he sees as a lack of competence and action, especially around the recent fires and the homelessness crisis.
And how does owning the LA Times fit into all this?
He sees it as a platform for truth and accountability,
Okay.
but also for reaching a wider audience in new ways.
I see.
He's launching LA Times Next with studios in LA,
Okay.
Washington, and even Nashville,
Nashville.
and developing a new content management system called Graphene that integrates video podcasts, live stream, the whole shebang.
Nashville? Is he trying to turn the LA Times into a country music empire? I'm picturing a headline, Transplant Surgeon Turned Singer Headlines Grand Ole Opry.
Maybe he's got a secret passion for banjo picking.
Right.
But seriously, it's all part of his vision to make news more engaging and accessible, almost like an interactive experience.
Okay.
He even talks about incorporating features similar to X.
So it's not just about changing the content, it's about changing how people consume it.
Right. He wants to build in things like a perspective meter,
Okay.
so readers can see the political leanings of opinion pieces
I see.
and get links to alternative viewpoints with supporting data.
Wow.
Imagine that a built-in fact check and a diversity of opinions all in one place.
I could see how that could be helpful.
Right.
Especially in today's polarized media landscape.
Absolutely.
But is that realistic? Can you really change how people engage with news on that fundamental level?
It's ambitious, but that's what makes it so intriguing.
Right.
And here's where it gets really interesting for our listeners in Texas.
Okay, hit me.
He's offered to share a grant file with other newspapers.
Oh, wow.
Imagine if local news outlets here could adopt a similar approach promoting more balanced, data-driven reporting.
That would be quite a shift. Okay, now I'm really curious about this Graphile thing. How does it actually work? Does it involve tiny robots delivering personalized news to your doorstep?
No tiny robots, unfortunately.
Oh.
But it does involve some pretty sophisticated technology.
Okay.
GramFi is designed to seamlessly integrate different types of media. So you could be reading an article about, say, a new development project in Deer Park,
Okay.
and then instantly access videos, interactive maps,
Right.
and even community forums all within the same platform.
Okay, that's starting to sound like something that could actually get people more engaged with local issues.
Right.
Imagine if we could access all the relevant information about a proposed zoning change or a new park development all in one place. It could make a huge difference in how people participate in local decision-making.
Exactly. And that ties into Dr. Soon-Shiong's bigger vision for a more informed and engaged citizenry.
I see.
He believes that access to information is crucial for people to hold their leaders accountable and make a difference in their communities.
And speaking of holding leaders accountable, he's not exactly shy about criticizing LA's mayor for what he sees as incompetence,
Right.
especially when it comes to dealing with those recent fires and the ongoing homelessness crisis.
He's especially critical of what he perceives as a lack of practical skills and a focus on ideology over effectiveness. He uses this great example: catalytic converter thefts were running rampant.
Oh, yeah?
And instead of addressing the underlying social and economic factors, the city council blamed Toyota for not making their cars theft-proof.
Now, that sounds awfully familiar. We've seen similar things happen right here in our own community,
Right.
where officials sometimes jump to blame others instead of tackling the root causes of problems.
It highlights a common frustration, right?
Yeah.
The feeling that sometimes common sense gets lost in the political shuffle.
And it makes me wonder if this highly accomplished transplant surgeon is getting frustrated with those kinds of issues in LA. What hope do the rest of us have?
Well, that's what makes his story so interesting.
Okay.
He's not just complaining.
Uh-huh.
He's taking action.
Okay.
He's trying to use his platform, his resources, and his unique perspective to shake things up, not just in healthcare,
Right.
but in media and local governance as well.
So is he some kind of superhero in a lab coat swooping in to save the day?
Not quite.
Okay.
But his story does raise some interesting questions about what's possible when someone with expertise and passion decides to step outside their comfort zone and try to make a difference.
And that's where the think and act locally connection comes in.
Absolutely.
It's about recognizing that we don't have to be transplant surgeons or newspaper owners to make a difference.
Right.
We can apply that same spirit of innovation and problem solving right here in our own community.
And sometimes hearing about how someone is tackling similar challenges in a different context can spark new ideas and inspire us to take action.
That's a great point. So what else is Dr. Soon-Shiong up to besides revolutionizing journalism and calling out politicians?
Well, he's also a vocal advocate for a more integrated approach to healthcare,
Okay.
using technology to improve patient care and empower individuals to take control of their health.
Right.
He even uses this great analogy of a rocket ship to describe his vision for the future of healthcare.
Rocket ship healthcare. Okay, now I really need to hear more about this.
Buckle up, listeners.
Buckle up, listeners. Things are about to get interesting.
He's talking about a system where technology allows for seamless data sharing, real-time monitoring, and personalized interventions.
Okay.
Imagine being able to track your vital signs at home and have your doctor instantly alerted if something seems amiss.
Wow.
It's like having a 24/7 personal health coach.
That sounds amazing, especially for folks with chronic conditions who need constant monitoring.
Right.
But wouldn't that be super expensive?
Well,
And what about privacy concerns?
he addresses those concerns directly in the interview,
Okay.
emphasizing the importance of creating a secure and interoperable system that puts patients in control of their data.
Okay.
He believes that technology can be a powerful tool for empowering individuals to take charge of their own health,
Uh-huh.
but it has to be done responsibly and ethically.
That's reassuring, but what does any of this have to do with us here in Southeast Texas? Are we ever going to see rocket ship healthcare in Deer Park or Pasadena?
That's a great question.
Yeah.
And it's one we should be asking our local healthcare providers and elected officials.
I like it.
Dr. Soon-Shiong's vision might seem futuristic,
Yeah.
but many of the technologies he's talking about are already available.
Mm-hmm.
It's a matter of implementing them effectively and ensuring equitable access for everyone.
So it's not just about having the technology, it's about having the will and the vision to use it to benefit our community.
Exactly. And that's where we, as informed and engaged citizens, can make a difference.
That's right.
We can ask questions, demand better healthcare options, and advocate for policies that prioritize innovation and accessibility.
It's about taking that think and act locally mindset and applying it to all aspects of our lives, from healthcare to education to local governance.
And sometimes hearing about what's happening in other parts of the country, even in a place as seemingly far removed as Los Angeles, can spark new ideas and inspire us to push for positive change right here at home.
That's a great point. So beyond rocket ship healthcare, what other surprises does Dr. Soon-Shiong have up his sleeve?
Well, he also shares some pretty thought-provoking
Okay.
and potentially controversial
Uh-oh.
views on long COVID and vaccination.
Okay, now this is something that definitely hits close to home for a lot of folks in our community.
For sure.
What's his take on these issues?
He's definitely raising some eyebrows with his perspective.
Okay.
He's concerned that the current focus on the spike protein in vaccines might not be enough to prevent long COVID,
Uh-huh.
and even suggests that the spike protein itself could be contributing to long-term health problems.
Oh, wow.
He uses the term spikeopathy to describe this phenomenon.
Spikeopathy, that sounds a little scary.
Right.
What exactly does that mean? And is he saying that vaccines are dangerous?
It's important to note that he's not anti-vaccine,
Okay, good.
but he is calling for a more nuanced and comprehensive approach to vaccine development.
Okay.
He wonders why there hasn't been more research into vaccines that target other parts of the virus,
Uh-huh.
aiming for complete viral clearance rather than just focusing on the spike protein.
So he's essentially advocating for a more holistic approach to both COVID and vaccine development.
Exactly.
Okay.
He's also very vocal about his concerns regarding the influence of pharmaceutical companies
Right.
and calls for more independent research and oversight when it comes to new medical treatments.
Challenging Big Pharma. That's a bold move. But it also makes me wonder if he's so concerned about the current approach to vaccination. What does he propose as an alternative?
Well, this is where things get really interesting.
Okay.
He reveals that he was actually part of Operation Warp Speed,
Really?
the government's initiative to accelerate vaccine development,
Uh-huh.
but was eventually warped.
Wait, he was kicked out of Operation Warp Speed.
Yeah.
That's a pretty big deal. What happened? Did he get too close to some uncomfortable truths?
He doesn't go into detail about the reasons for his departure,
Okay.
but it suggests that he had some fundamental disagreements with the direction of the program.
Okay, now I'm really intrigued. This is starting to sound like a medical thriller. Is there a conspiracy afoot?
I wouldn't go that far,
Okay.
but it does raise some important questions about transparency
Yeah.
and whether all scientific perspectives were given due consideration during the vaccine development process.
And it definitely highlights Dr. Soon-Shiong's willingness to speak his mind, even when it might ruffle some feathers.
Exactly. He's not afraid to challenge the status quo.
Uh-huh.
And that independent thinking extends to another surprising area.
Okay.
His support for Robert F. Kennedy Jr.
Wait, RFK Jr., that's unexpected. I thought he was known for his controversial views on vaccines.
He is, and that's why Dr. Soon-Shiong's support for him has generated a lot of discussion.
So is Dr. Soon-Shiong aligning himself with those controversial views? Is he questioning vaccine safety?
It's more nuanced than that.
Okay.
Dr. Soon-Shiong emphasizes that he admires Kennedy Jr.'s willingness to challenge powerful institutions and speak truth to power even when it's unpopular.
I see.
He sees a parallel between Kennedy Jr.'s questioning of vaccine safety and his own concerns about the long-term effect of COVID and the current vaccination approach.
So it's less about agreeing with every single one of Kennedy Jr.'s views and more about appreciating his willingness to ask tough questions and challenge the narrative.
Precisely.
Okay.
It's about encouraging critical thinking,
Right.
open debate, and a willingness to consider different perspectives even when they're controversial.
Okay, I can see the value in that.
Yeah,
Even if I don't necessarily agree with everything Kennedy Jr. has said,
right.
it's about fostering a culture where we can have these difficult conversations without resorting to censorship or demonizing those who hold different views.
Exactly. It's about recognizing that even the most respected experts can have differing opinions.
Right.
And those differences can be valuable sources of insight and learning.
And that's a message that resonates deeply with our mission here at Think and Act Locally. We're all about encouraging our listeners to engage in thoughtful dialogue, consider multiple perspectives, and make informed decisions about the issues that affect their lives and their community.
And sometimes that means stepping outside our comfort zones, challenging conventional wisdom, and being willing to have those tough conversations,
Right.
even when they're uncomfortable.
That's a powerful message, and it's something we should all strive for. But enough about challenging the status quo for now. Let's get back to Dr. Soon-Shiong and his attempts to make a real difference in the here and now, specifically in the area of homelessness, which is a major issue, not just in LA,
Right.
but right here in our own community as well.
You're talking about his efforts to revitalize St. Vincent's Medical Center, a Cloa hospital in LA.
Right?
He had this ambitious vision of transforming it into a much-needed mental health and homeless care facility, but things didn't exactly go according to plan.
Ah, yes, the St. Vincent saga. What happened there? Why couldn't he make it work?
He ran into a wall of bureaucratic obstacles and resistance from city and state officials,
Oh, no.
despite taking both Gavin Newsom and Karen Bass on tours of the facility to try and rally support.
I'm sensing a pattern here.
Yeah.
It seems like Dr. Soon-Shiong has a knack for running headfirst into bureaucratic roadblocks.
It's certainly a recurring theme in his story.
Yeah.
He's clearly someone who's used to taking action and finding solutions.
Right.
But even with his resources and connections, he's encountering the limitations of these large, complex systems.
But here's what I find interesting. He doesn't seem to be giving up. He's still advocating for change and challenging the status quo, even when it's frustrating and seemingly impossible.
You're right.
Yeah.
He's not just throwing his hands up in defeat.
Right.
He's using his platform to raise awareness, point out the flaws in the current system, and advocate for practical solutions.
And that's where his story becomes truly inspiring, because it shows that even in the face of seemingly insurmountable obstacles, one person can still make a difference.
Absolutely.
It's about having the courage to speak up, to challenge assumptions, and to keep pushing for change, even when it's hard.
And that's a message that resonates no matter where you live, whether it's Los Angeles or Deer Park, Texas.
Absolutely.
It's about recognizing that we all have a role to play in making our communities better.
Right.
And that even small actions can have a ripple effect.
So what can our listeners in Deer Park, LaPorte, and Pasadena take away from Dr. Soon-Shiong's experience with St. Vincent's and his broader efforts to address homelessness?
It's a reminder that these are complex issues with no easy solutions, but that doesn't mean we should give up.
Right.
We can start by educating ourselves about the challenges facing our own community, supporting organizations that are working to make a difference, and advocating for policies that prioritize compassionate and effective solutions.
It's about taking that think and act locally spirit to heart and recognizing that even in the face of complex systemic problems, we can still make a difference one person, one action at a time, but we'll delve more into those specific actions in just a bit.
Right. We've covered a lot of ground already, from Dr. Soon-Shiong's remarkable background to his efforts to shake up both healthcare and journalism.
Yeah, for sure.
But there's still so much more to unpack.
Indeed. We've only just scratched the surface of this fascinating interview. When we come back, we'll explore Dr. Soon-Shiong's experience at St. Vincent's in more detail, including specific obstacles he encountered and the alternative approaches to mental health and homelessness that he's advocating for.
And we'll also delve deeper into his vision for the future of healthcare, including those intriguing rocket ship ideas and what they might mean for us right here in Southeast Texas.
Stay tuned.
Stay tuned.
We left off talking about St. Vincent's Medical Center.
Right.
And Dr. Soon-Shiong's attempt to turn it into a resource for folks experiencing homelessness and mental health challenges.
Right.
It seems like a no-brainer to repurpose an empty hospital for something so desperately needed. What went wrong?
He ran into a bureaucratic brick wall.
Oh, man.
Outdated regulations, pushback from other healthcare providers, a general lack of urgency from officials.
Yeah.
It's a classic example of good intentions getting bogged down in the system.
But here in Texas, we're no strangers to those kinds of roadblocks.
Right.
Our listeners are dealing with permitting delays, funding shortages, you name it.
Sure.
It could feel like you need an advanced degree in bureaucracy just to get anything done.
It's true. And that's why Dr. Soon-Shiong's experience is so relatable, even though it's happening on the other side of the country. He's not letting it discourage him, though.
Okay, good.
He's still pushing for change, pointing out the absurdity of seeing people suffering on the streets when there's a perfectly good hospital sitting healthy.
He makes this powerful comparison in the interview, saying, witnessing homeless individuals in dire need of mental health care is like seeing patients dying in the street because they need a Whipple procedure.
Right.
Which is a complex pancreatic surgery.
Yes.
For a surgeon, that's a pretty jarring image.
It is.
Yeah.
It really highlights the disconnect between the urgency of the situation
Right.
and the slow pace of bureaucratic action.
That's a good point.
He even calls out the city's spending on homelessness, mentioning those $200,000 hotel rooms we've discussed before.
Oh, yeah.
Arguing that money could be better spent on providing real long-term solutions.
Okay, but what are those solutions? Is he just complaining or does he have concrete ideas?
He absolutely does.
Okay, lay it on us.
He talks about reopening Lanterman and Petra Short Act facilities, which are designed for short-term involuntary psychiatric holds.
Okay.
He also suggests reevaluating the criteria for gravely disabled, a legal term used to justify involuntary treatment.
I see.
And even mentions bringing back vacancy laws, arguing that sometimes people need to be compelled to get the help they need.
Whoa, vacancy laws. That sounds pretty controversial. Isn't that criminalizing homelessness?
He acknowledges the sensitivity of the issue.
Okay.
But his point is that sometimes compassion means taking difficult actions to protect individuals who are unable to care for themselves.
Okay.
He emphasizes that modern psychiatric care is nothing like the outdated images we might have from movies like One Flew Over the Cuckoo's Nest.
That's an important distinction. Mental health care has come a long way, but the stigma still lingers.
Absolutely.
Yeah, it's a tough conversation, but one we need to have if we're serious about finding solutions.
Exactly. And Dr. Soon-Shiong isn't afraid to challenge those deeply ingrained beliefs about mental health and homelessness. He's pushing for a shift away from blame and ideology towards practical solutions and compassionate care.
I'm hearing a theme here, practical solutions, and a focus on competence that seems to be his mantra, whether he's talking about healthcare journalism or even local governance.
You're absolutely right.
Yeah.
He's frustrated by what he sees as a lack of competence in leadership, a disconnect between good intentions and effective action.
Yeah.
He even mentions hearing stories of homeless people being told that their problems are due to capitalism.
Oh, wow.
Which for him highlights how ideology can sometimes cloud judgment.
And this brings us back to his support from Robert F. Kennedy Jr.
Right.
Someone who's not afraid to challenge the system and question conventional wisdom, even if it makes people uncomfortable.
Exactly. They both seem to share this deep skepticism of the status quo and a willingness to dig deeper, ask tough questions, and demand accountability from those in power.
Okay, but how does that translate to action? What are they actually proposing to do about these issues?
It's less about specific policy prescriptions and more about a shared mindset.
Okay.
A commitment to transparency, scientific rigor, and a focus on solutions rather than ideology.
So it's about asking the right questions.
Right.
demanding evidence,
Yes.
and challenging assumptions, whether it's about vaccine safety, the causes of homelessness, or the best way to deliver healthcare.
Precisely, it's about empowering individuals with the knowledge and tools they need to make informed decisions and hold their leaders accountable.
And that aligns perfectly with our mission here at Think and Act Locally. We're all about giving our listeners in Deer Park, LaPorte, and Pasadena the information and resources they need to make a difference in their own community.
And Dr. Soon-Shiong's story, even though it's unfolding in Los Angeles,
Right.
offers some valuable lessons for us here in Southeast Texas.
What are those?
It shows that change is possible even within large, complex systems
Yeah.
if we're willing to challenge the status quo, ask tough questions, and demand better from our leaders.
It's about recognizing that we don't have to accept things as they are.
Right.
We could demand better healthcare, better schools, better infrastructure, a better quality of life for everyone in our community.
And that brings us back to his vision for the LA Times.
Okay.
He wants to create a platform that encourages open dialogue, challenges assumptions, and presents information in a balanced, data-driven way.
He even compares his new platform to X in terms of its potential for engagement and interactivity.
He sees the value in those platforms for connecting people and fostering discussion.
Right.
But he wants to combine that with the rigor and accountability of traditional journalism.
So it's about taking the best of both worlds.
Exactly.
The dynamism and reach of social media with the credibility and depth of investigative reporting.
Exactly. And he's not just talking the talk, he's putting his money where his mouth is, investing heavily in new technologies and innovative approaches to storytelling.
I like it.
And he's offering to share those innovations with other newspapers, potentially transforming the entire industry. Imagine if local news outlets here in Southeast Texas could adopt a similar approach.
Wow.
Promoting more balanced, data-driven reporting
Right.
and fostering more meaningful engagement with their audiences.
It's an exciting prospect, and it highlights the power of innovation to disrupt even the most established industries.
For sure.
It's about recognizing that we don't have to be stuck in the old ways of doing things.
Right.
We can embrace new technologies, new approaches, and new ways of thinking to create a better future.
And that's a message that resonates across all sectors, from healthcare to education to local government.
That's right, I like it.
It's about being willing to experiment,
Uh-huh.
to take risks,
Yeah.
and to challenge the status quo in pursuit of a better tomorrow.
It's about embracing that think and act locally spirit and recognizing that we all have the power to make a difference no matter where we live or what our background is. But enough about the big picture. For now, let's get back to Dr. Soon-Shiong's specific ideas about healthcare, especially that intriguing rocket ship analogy he uses to describe his vision for the future.
Right. He's talking about a system that leverages technology to create a more integrated, personalized, and proactive approach to healthcare.
Okay.
Imagine being able to track your vital signs at home,
Okay.
share that data seamlessly with your doctor, and receive personalized feedback and interventions in real time.
Okay, that does sound pretty futuristic, but is that even realistic? Do we have the technology to make that happen? And what about the cost? Would something like that be accessible to everyone, or would it just be a luxury for the wealthy?
He addresses those concerns head-on in the interview.
Okay, good.
He believes that many of the technologies needed to create this rocket ship healthcare system are already available.
Uh-huh.
It's just a matter of implementing them effectively and ensuring equitable access for everyone.
Okay.
He sees a huge opportunity to utilize readily available technology for things like remote patient monitoring and telehealth,
Right.
especially in rural areas where access to specialized care can be limited.
Now, that's something that could have a real impact right here in Southeast Texas.
Right.
We have a lot of rural communities where people have to drive long distances to see a specialist.
Sure.
And telehealth could really help bridge that gap.
Exactly. And he's not just talking about treating existing conditions. He's talking about using technology to prevent illness in the first place.
Oh, wow.
Imagine a system where your doctor could identify potential health risks based on your lifestyle, genetics, and environmental factors,
Okay.
and then work with you to create a personalized plan to mitigate those risks.
So it's about moving away from reactive care, where we wait until people are sick to intervene,
Right.
and towards a more proactive, preventative approach?
Exactly. And that's where technology can play a powerful role. Imagine having a virtual health assistant that can help you track your progress, provide personalized coaching, and connect you with the resources you need to stay healthy.
Okay, that sounds amazing, but I can't help but think about the folks who might not have access to those technologies or who might not be comfortable using them.
Yeah.
Wouldn't this kind of system exacerbate existing health disparities?
That's a valid concern,
Yeah?
and one that Dr. Soon-Shiong acknowledges in the interview.
Okay.
He stresses the importance of addressing digital literacy and ensuring equitable access to technology as we move towards this more digitally driven healthcare model.
Okay.
He believes that technology has the potential to democratize healthcare and empower individuals to take control of their own health, but has to be done thoughtfully and with a focus on equity.
It's about making sure that everyone, regardless of their income, education, or technological proficiency, can benefit from these advancements?
Exactly, and that requires a multifaceted approach,
Ok-
including investments in digital infrastructure,
Uh-huh.
digital literacy programs, and policies that prioritize affordability and accessibility.
It's about recognizing that technology is a tool, and like any tool, it can be used for good or for ill. It's up to us to ensure that it's used to create a more equitable and just healthcare system for everyone.
That's a powerful message, and one that resonates far beyond the realm of healthcare.
Absolutely.
It's about recognizing that we have a responsibility to shape technology in a way that serves humanity rather than the other way around.
It's about taking that think and act locally spirit and applying it to the global challenges we face,
Right.
recognizing that even small actions can contribute to a larger movement for positive change, but we'll delve into those larger questions later for now. Let's bring the focus back to Dr. Soon-Shiong's more immediate concerns, particularly his controversial views on long COVID and vaccination.
Right. He's ruffled some feathers with his skepticism about the current focus on the spike protein in vaccines. And his suggestion that the spike protein itself could be contributing to long-term health problems. He even uses the term spikeopathy to describe this phenomenon.
Okay, I'm still a little fuzzy on what exactly spikeopathy means and what evidence there is to support this idea. Can you break it down for us?
He's suggesting that the spike protein, which is the part of the virus that vaccines typically target,
Right.
could be triggering an inflammatory response in the body that leads to long-term health complications.
Okay.
He points to emerging research suggesting that the spike protein can persist in the body even after the initial infection is cleared,
Uh-huh.
potentially causing damage to various organs and systems.
So it's not that the vaccines themselves are dangerous, but that focusing solely on the spike protein might not be the most effective way to prevent long COVID.
Exactly. He's calling for more research into vaccines that target other parts of the virus, aiming for complete viral clearance rather than just blocking the spike protein.
Okay.
He also expresses concern about the potential for the spike protein to cross the blood-brain barrier, which could have implications for neurological health.
Now, those are some pretty serious claims, but is there any scientific evidence to back them up, or is this just speculation?
It's a complex and rapidly evolving area of research.
Okay.
While there's some evidence to suggest that the spike protein could be playing a role in long COVID,
Uh-huh.
it's still too early to say for sure. More research is needed to fully understand the mechanisms involved
Right.
and to determine the potential long-term effects of both the virus and the vaccines.
So it's a wait-and-see situation.
In a sense, yes.
Okay.
But it's also a call to action.
Okay.
Dr. Soon-Shiong is advocating for more transparency and open discussion about these issues,
Okay.
more research into the potential risks and benefits of different vaccine strategies,
Uh-huh.
and more proactive approaches to preventing and treating long COVID.
He's not just raising concerns, he's pushing for solutions.
Exactly. He's challenging the status quo, questioning conventional wisdom, and pushing for a more nuanced and evidence-based approach to public health.
And that's something we can all appreciate, even if we don't necessarily agree with all of his views.
Right.
It's about fostering a culture of critical thinking where we're encouraged to ask tough questions, demand evidence, and challenge assumptions, even when it makes us uncomfortable.
It's about recognizing that science is a process of ongoing discovery, not a set of fixed truths. And it's about demanding that our leaders and institutions be transparent and accountable,
Right.
especially when it comes to issues that affect our health and well-being.
And those are values that resonate deeply with our mission here at Think and Act Locally. We're all about empowering our listeners to engage in thoughtful dialogue, consider multiple perspectives, and make informed decisions about the issues that matter most.
And sometimes that means being willing to question the narrative, challenge authority, and demand better from our leaders and institutions.
It's about recognizing that we all have a role to play in shaping a better future, and that even small actions can make a difference.
And on that note, we'll delve deeper into Dr. Soon-Shiong's surprising connection with Robert F. Kennedy Jr.,
Okay.
someone who's made a career out of challenging authority and questioning conventional wisdom when we come back after the break.
We're back, and I'm still processing that Dr. Soon-Shiong, this brilliant surgeon and innovator, is a supporter of Robert F. Kennedy Jr., who's Let's just say a bit of a lightning rod for controversy.
It definitely raised my eyebrows too, but the more I think about it, the more it makes sense in the context of Dr. Soon-Shiong's broader message about challenging assumptions and demanding accountability.
So it's not about blindly agreeing with everything Kennedy Jr. says. It's about appreciating his willingness to ask the tough questions.
Exactly. Dr. Soon-Shiong specifically highlights Kennedy Jr.'s ability to dissect complex systems and expose potential conflicts of interest, particularly within the pharmaceutical industry. And let's be honest, that industry hasn't always had the most spotless track record.
Yeah, there's definitely a history of prioritizing profits over people sometimes, but how does that tie into Kennedy Jr.'s more controversial stances like his views on vaccines?
Dr. Soon-Shiong seems to see a connection between Kennedy Jr.'s questioning of vaccine safety and his own concerns about long COVID. They both challenge the dominant narrative, demand more evidence, and advocate for a more cautious and nuanced approach.
So it's about challenging the status quo even when it's uncomfortable.
Exactly. It's about fostering a culture where dissenting voices are heard and where scientific inquiry is truly open and transparent.
Okay, I can see the value in that, even if I don't agree with every single one of Kennedy Jr.'s views. It's about encouraging critical thinking and open debate, which is something we strongly believe in here at Think and Act Locally.
Absolutely. It's about empowering individuals to think for themselves, evaluate evidence, and form their own conclusions rather than blindly accepting what they're told.
And it's about recognizing that even the experts can be wrong, that science is constantly evolving, and that there's always more to learn.
Dr. Soon-Shiong's story is a perfect example of that. Here's someone who's at the top of his field, a pioneer in medicine and technology, and he's still asking questions, challenging assumptions, and pushing for a better way.
It's inspiring, really. It shows that we don't have to be passive recipients of information. We can be active participants in shaping our world, even in the face of complex and daunting challenges.
And that's a message that resonates deeply with our mission here at Think and Act Locally. We're all about empowering our listeners in Deer Park, LaPorte, and Pasadena to make a difference in their own communities.
It's about recognizing that change starts at the local level, with individuals taking action, asking questions, and holding their leaders accountable.
And sometimes it means looking beyond our immediate surroundings for inspiration and learning from people like Dr. Soon-Shiong who are challenging the status quo and pushing for a better future, no matter how difficult it might seem.
It's about believing that change is possible, that even small actions can make a difference, and that we all have a role to play in building a better world.
And on that note, we want to thank you for joining us on this deep dive into the world of Dr. Patrick Soon-Shiong, who embodies the spirit of innovation, compassion, and a relentless pursuit of a better tomorrow.
We hope this conversation has sparked your curiosity, challenged your assumptions, and inspired you to think and act locally in your own community.
Remember, change starts with each of us. So what will you do today to make a difference?
Until next time, stay curious, stay engaged, and keep thinking and acting locally. If you find value in our show, please consider supporting us at thinkandactlocally.com/donate.